back, or welcome for the first time to this month's meeting of the Kansas COVID Vaccine Equity Task Force. This meeting is being recorded and live streamed on the KDHE YouTube channel. My name is Jimena Garcia, and I'm the Governor's Senior Advisor for Vaccine Equity. I am going to be leading this discussion today together with Dr. Kali Akers and her team at KUMC, and also my colleagues from KDHE. So super excited about today's meeting. We have 3 guest speakers who will share their expertise related to the 2023 COVID vaccine. Also talk to us about COVID infections and RSV flu, all in Kansas, what's happening in Kansas. Also, we're going to hear about details about the bridge program for people without insurance to be able to access no-cost COVID-19 vaccine. And at the end, a word about independent pharmacies and their role in the bridge program. So we can do a quick review of the agenda. Vicki, if you don't mind putting it up. We're going to start with introductions. Sorry. Okay, then we're going to have Jamie Gable, Senior Epidemiologist at KDHE, share the vaccine rates for the newest 2023 COVID vaccine. And then we have Dr. Duvey, who is going to come on and do a presentation about COVID, RSV, and flu, or the pan respiratory viruses, followed by Becky Prawl, immunization section chief, who is going to go through information about the bridge program, how the rollout is going. And finally, Amanda Applegate from the Kansas Pharmacy Association is going to share about the role of independent pharmacies in providing no-cost vaccine in areas of Kansas, especially where there are no Walgreens or CVSs. So let's jump in. If you're attending this meeting for the first time and would like to, we'd love to hear from you. Just take a moment to introduce yourself and a few words about something that you're passionate about. If you're a returning member, please just put your name and organization into the chat. So I'll open the floor. Is there anybody new that would like to say hi?
Well, good morning, afternoon, everyone. This is Dr. Tammy Counts with Family Counseling Consultants, also in partnership with Kansas Black Farmers Association. It is a beautiful day here in Manhattan. We're in our second day of conferences here on Kansas Black Farmers and Association in support of USDA. I just want to say thank you to Dr. Garcia, to Dr. And all the others that have been helpful. We had our first event this weekend with the Willa Gill Community Center in Wyandotte County. We were blessed to serve 283 people who came through and received a hot meal. Unfortunately, we weren't able to vaccinate, but we did also test, complete the A1 screenings, as well as blood pressure checks, and also check a few mouths for the healthiness and pass out some toothbrushes, toothpaste, and lots of blankets because it's getting cold here in Kansas. So we want to thank you all for the grants that we have received to support us in this effort. And we're looking forward to November and an opportunity to get shots in the arms. Thank you.
Really appreciate your work, Dr. Counts, and sharing with us. That's pretty impressive, almost 300 people. Okay, I don't see any. And if there's no other introductions, we'll just jump in. So I'm going to pass the floor now to Jamie Gable, who is going to review the most recent COVID vaccine data with us.
Thank you for having me, Dr. Garcia. So this month, we're going to take kind of our first deep dive into the data for the new COVID-19 vaccine that was updated for the 2023-2024. And CDC typically refers to this as the 2023-2024 COVID-19 vaccine formula. So that's how we have it presented on this slide. Numbers are still small here, but this is going to keep us focusing on what's currently happening with COVID vaccinations in Kansas. The number and percent of total Kansans with the updated formula is available on our dashboard. And in November, we're going to be rolling out a redesigned dashboard that is going to have more data breakdowns with the new COVID vaccine than it currently has. Our first slide is the overview of vaccine uptake in Kansas as of October 11th for the 2023-2024 updated COVID-19 vaccine formula. Overall, currently the uptake is low, which is expected because the approval is pretty recent. And we know that availability in some locations was delayed a little bit initially. So about 2% of all Kansans have received an updated dose, but the week before that, it was only 1.3%. And as of yesterday, I was able to get an update on the statewide coverage, which is now at 3.1%. So we know that we're in a period where we can expect to see numbers grow quite a bit, which is good. And so we'll see a lot more and know a lot more next month when we have more data. Adults age 65 plus have the highest coverage at 7.4%. Next slide, please. This slide, we have our updated formula uptake across different races and age groups. Native data here is, it looks at those in our WebIZ who have any race indicated as Native. So Native is considered at least one of their races. They are put into the Native category, and they have the highest coverage for all age groups. White has the second highest coverage for adults and older adults, and then both white and Asian have the highest coverage for children. Hawaiian Pacific Islander Kansans tend to have the lowest coverage in all categories. And you can see for the children, it's actually, there are no vaccinations for Hawaiian Pacific Islander currently. That's not to say that it could not be a true zero, because there could be multiracial people with Hawaiian Pacific Islander who are getting vaccinated, but they won't fall into this category due to that factor. And you can see that in a lot of cases, the coverage for total Kansans is higher than any of the individual race categories. We do have a number of individuals that are either categorized as unknown or multiracial. So they're not counted in the total Kansan. They are counted in the total Kansans, but unless one of their races are Native, they're not included in the race breakdowns. Next slide, please. So as we move to the ethnicity slide, I just want to remind everyone that this is calculated independently of the race. So they're on separate slides to help make that distinction. And what I mean when I say that is that the race is calculated. So if somebody is Black and Latino or Hispanic, they would be included in the rates for Black, and they would also be included in the rates for Latino Hispanic. This slide is organized similar to the previous slide, and now we're looking at race, or at ethnicity instead of race, sorry. For the updated COVID vaccine, Hispanic and Latino Kansans tend to have lower coverage than non-Hispanic Latino Kansans. And while numbers are still small across the board, the difference in the children and 18 plus do look a little bit concerning right now, although the difference in coverage for 55 plus age group is less drastic. Those are the slides I have. I'm going to check the chat real quick just in case a question came up. How are the numbers are accounted for if folks on the state line get vaccinations? So if they get a vaccination in Kansas and their state is Kansas, they come into our WebIZ. We are currently working on a connection with Missouri so that our IISs can exchange information. But due to the fact that we do have a lot of the same patients, we're being careful with how we implement it before we pull the trigger, because we don't want to create thousands and thousands of duplicates in our system. So if they are vaccinated in Missouri, it's not in our system yet, but it is something that will be happening soon.
Thank you for that question, and thanks for the answer. I wondered about that too. Wonderful. Well, thank you so much, Jamie, for doing the work on the data and presenting it to us. Okay, so next up, we have Dr. Joan Duvey, State Health Officer and friend. Thanks for being here with us, Joan, and I'm going to pass the floor to you now.
Thank you so much, Dr. Garcia, and thanks everybody for joining. I'm just going to provide a pretty quick update on COVID-19 and say a few words about influenza as well and RSV. So next slide, please. So COVID-19 is here to stay. I think at the beginning of the pandemic, we were all looking forward to the day when we could say, okay, we lived through it, and now it's gone. But unfortunately, what we are seeing is that COVID-19 continues to have a presence. It continues to produce variants that, are circulating. It is alive and well. And so we need to be able to live with this virus and to stay alive and well as well. It does continue to be a major cause of serious respiratory illness in the United States. Just a reminder that we have lost more than 200,000 Americans since January of 2022, and more than 600 in children and adolescents, 0 through 19 years of age. And over the past week, emergency room visits and hospitalizations due to COVID-19 have increased slightly in Kansas, but they continue to remain at low levels overall. A reminder also that it's infants less than 6 months of age and adults greater than 75 years who are at highest risk for hospitalization, and then followed by adults between the ages of 65 and 74, according to the CDC. And just a reminder again that those infants less than 6 months of age are too young to receive a COVID vaccine. And so if there's one thing I want you to take away from this presentation overall, is really the importance of reaching individuals who are pregnant and getting them vaccinated for COVID, flu, and RSV to protect those infants during their first 6 months of life. More than half of children younger than 2 years admitted to an ICU with COVID had been healthy, no underlying medical conditions, no immune deficiencies, no asthma, nothing, healthy young kiddos. And they can get very, very sick with COVID. So getting young children, those tender age vaccines into arms is, again, really important for keeping our kids healthy. And infants younger than 6 months who are not eligible, this is just repeating what I said earlier, do have the highest rates of hospitalization. Again, the importance of immunizing the people who are during pregnancy, people during pregnancy in general. Okay, next slide, please. And so this is data from the CDC COVID data tracker, and you can see Kansas in green is good. You can see there are a couple of counties that have a bit higher rates of hospital admissions in that map on the left-hand side. But overall, Kansas is still at a low level of hospital admissions for the entire state. And the slide, or the picture on the right, the map, is showing the percent change in emergency department visits from the prior week. And that teal color is saying that there has been a substantial decrease of about 20% in those emergency department visits from the past week in Kansas. So overall, that is good news for us. Next slide, please. And this is showing new hospital admissions, and those are the bars. And then I just superimposed the death rate, and this is for Kansas. And the good news is you can see that the death rate is flattening out. So we are not, losing a lot of Kansans to COVID so far this respiratory season. And I think that's really important. And vaccination and increasing those immunization rates will help keep people out of the hospital and will help make sure that they, are alive and can celebrate, the upcoming holidays with their families. So getting that vaccine in arms is really important. And we see that for new hospital admissions, You were actually at a lower rate than we were in the late summer of 2020, which is very nice. And we can see that those bars are going up and down, but just ever so slightly. So there is a bit of an increase over the past week, but again, it's not significant at this point. Next slide, please. And this is our syndromic surveillance data. These are emergency department visits for COVID-19. And these are the weekly percentage of all emergency department visits that are diagnosed as COVID-19. And again, we see that we did have a little bit of a peak late summer, and that has come down. And I think that probably was a result of kids going back to school, if I had to guess. But we see now that we are starting to level out and maybe increase a little bit. So the vaccine, the annual COVID shot got here just in time for us to get that and hopefully continue this downward trend. Next slide, please. This is just a reminder of, how many variants there have been and how those move around and change, and they're different from state to state. This is actually the estimates for Region 7 for the 2-week period, for 2-week periods, and the last 2-week period ended the 14th of October. And what we're seeing is a new variant, HV.1, made up about 24% of the new COVID cases in Region 7 during that 2-week period. EG5 is a variant that we had been talking about previously. It's becoming a little bit less important now, making up just over 22%. And then the next most common is this XBB.1.16 Arcturus, and followed by FL.1.5.1 or Fornax. And the interesting thing is some of these variants have been in the news, with the potential for evading immune response, even immune response related to previous infection or previous vaccination. But the hospitalization data just aren't showing us that. So I think what we're seeing is that, we're continuing to see new variants. Some of them may have been designated as variants of concern, but we just aren't seeing really the increases in illness, hospitalization, or even death related to these variants. So that is good news. Next slide, please. Just a reminder about our statewide testing program. We're continuing to offer free testing through KDHE at our K through 12 schools who are continuing to participate with us. Early childcare settings, jails, homeless shelters, and at our community and volunteer testing program sites. And then also some testing that is, so a lot of that is point of care testing or the antigen testing, but there's also testing done through our state contracted reference laboratories that you can get through our community testing partners, mainly pharmacies in our communities, who are still testing as part of our program. And at this time, we have not established an end date for this testing program. We know that the COVID funding that we've received from the CDC, that the date for using all that money has been extended into 2026. So I think we, are good to, at least for the time being, to continue providing this free testing in communities across Kansas. Next slide, please. And right now, we have 95 counties that have free testing sites. There are still 10 counties that don't, and you can see those on this slide outlined in red. So if you are someone who knows of a partner in those counties, it could be a pharmacy partner as part of our community testing program, or a volunteer testing partner, a faith-based community or community-based organization, please let us know, because we will reach out. We would love to assure that any Kansan can access free testing, regardless of which county they live in. So many of these sites, I'll just add, are also participating in our COVID therapeutics program. And that program will eventually come to an end as the treatments for COVID, like Paxlovid or Molnupiravir, become commercialized and are no longer available through the federal government. But as for now, we have some of our testing partners who are supporting and offering those therapeutics in their communities to make sure that people who are at risk for severe COVID disease can have access to them when they need them. Next slide, please. And another reminder, you may have seen this in the news, that the Biden administration is restarting their free test distribution through the mail. So if you go to covidtest.gov, you can place an order, and all households will be able to receive 4 tests delivered by the post office at no cost. So very glad that they have reinstated that program. Next slide. So just a reminder that the most effective tool to protect yourself this fall and winter is vaccination. And the FDA continues to state how confident they are in the safety and effectiveness of the updated vaccines. The vaccine is based on one of the Omicron variant lineages and is expected to provide better protection against the currently circulating variants than the older vaccines. And we even the newer variants, there are laboratories that are looking for effectiveness, and it seems to the new updated vaccine seems to be very protective. And that's just what this means about antibody responses. They were 17 times higher compared to the before vaccination and the old vaccine. So on September 12th, the CDC did recommend COVID-19 vaccine updated for the 2023 to 2024 season for everyone age 6 months of age or older to protect against serious illness. Again, get vaccinated to protect yourself against severe illness, hospitalization, and even death. And thereby you are protecting those who are around you as well, and reduce the chance of having long COVID. And the FDA does anticipate that the composition of the COVID-19 vaccine, like the seasonal influenza vaccine, will need to be updated annually. So it appears that we'll be getting a couple of seasonal vaccines moving forward. Next slide, please. And I just heard a podcast from Dr. Mandy Cohen, the new CDC director. She said that nationwide, more than 10 million people have already received the updated COVID vaccine. I know I got mine last week. Very happy that I was able to do that, as I'm visiting my elderly mom in another week or so. And so just overall, the Kansas metrics, and I know we have this information on our website too, but I just pulled this from COVID Act Now. It seemed to be a nice synopsis of kind of what percentage of the population has received how many doses. Next slide, please. Under the Affordable Care Act, all insurance companies are required to cover vaccines that are recommended by the Advisory Committee on Immunization Practices, and that includes the updated COVID-19 vaccine. So at no charge. And I was able to walk into a pharmacy, get my vaccine, and walk out and never had to open my pocketbook. All children without insurance can also get their COVID-19 vaccine under the Vaccine for Children program, and again, at no cost. And uninsured or underinsured adults can get their COVID-19 vaccine for free under the Bridge Access Program, and I think we're going to hear more about that. And you can go to vaccines.gov to find a location where you can get your COVID-19 vaccine at no cost if you are underinsured or uninsured as an adult. Next slide, please. And this is just information about vaccine dosing. So I think, Jimena, I think you're going to distribute these slides, so I'm not going to go through all this, but just how many vaccines, you know, what to do if you haven't received a vaccine, what to do if you have already been boosted and you want to get this seasonal vaccine, et cetera. Just a reminder that COVID-19 vaccines are safe to give during pregnancy, and pregnant people should get the updated COVID-19 vaccine to protect both themselves and their baby. Next slide. And here are just some infographics, which I think are really nicely done this year by the CDC. The one on the left is what you will need, what the recommended number of doses are, and how to space them if you are not moderately or severely immunocompromised. And on the right-hand side, this is the recommendation for people who are moderately or severely immunocompromised. And I think the last vaccine to arrive on the scene this season has been Novavax in terms of COVID vaccines. And these infographics do contain information about Novavax. And Novavax is a little bit different because it's not an mRNA vaccine like the Moderna or the Pfizer vaccines. It is more similar to vaccines that we are used to getting. And so for some people, this may be a good option. Next slide, please. And so now I want to say a word about where we are in terms of RSV in Kansas. And again, this is syndromic surveillance data and influenza. So the one on the RSV slide on the top, or picture on the top, is all visits for respiratory syncytial virus, the percentage of Kansas Emergency Department visits for anyone with RSV. And the bottom one is specifically for pediatric patients. And so we see on the bottom and even here that, you know, that curve is bending slightly up. So we are getting into the traditional RSV season. Typically we think about RSV as peaking in November, December, and January. And so we are heading in, and it's interesting that, we may begin seeing those lines creep up a bit. And as of yet, flu has not been a significant player. In fact, so far this fall, and Dr. Cohen just said this on the podcast, we have really had a pretty quiet respiratory season. And I'm knocking on wood because I hope it stays that way. So just a reminder that RSV, I think we're all familiar with flu, but just a reminder that RSV usually is very mild in adults and older children, and we might just blow it off as a sort of common cold. We have a runny nose, a dry cough, maybe some sneezing, maybe a headache. But those people who are at increased risk of severe and even life-threatening RSV infection do include those infants, especially premature infants or babies who are 6 months of age or younger, children who have heart disease that's congenital from birth or chronic lung disease, children or adults with weakened immune systems from diseases such as cancer or chemotherapy treatment of cancer, or children who have neuromuscular disorders like muscular dystrophy, adults that have heart disease or lung disease, and those older adults, adults who are over 65. So just a reminder about those symptoms and why this disease is so important to prevent if we're able. And for the first time, now for adults, we have a vaccine, and we have a vaccine that is going to be generalized or generally recommended for infants who are younger than 8 months of age. Next slide, please. So RSV vaccine has been approved for individuals 60 years of age and older. And this has been approved under shared decision-making considerations. So talking to your doctor about whether this vaccine is right for you or not. And there are 2 vaccines that are available. And then there is an RSV vaccine called nirsevimib that is available for infants younger than 8 months of age. And those are children who are born during or entering an RSV season. So if their mother got vaccinated, then most infants younger than 8 months of age will not need to get this vaccine. So if mom got vaccinated at least 14 or more days before the child was born, then the infant will not need to get vaccinated for the most part. Some infants who have severe immunocompromising disease or other conditions, there may still be a recommendation, but in general, as if moms get vaccinated, their babies are good. And then 1 dose of nirsevimab is recommended for infants and children who are older, 8 to 19 months, who are at increased risk for severe disease, and they're going into their 2nd RSV season. So those infants we talked about earlier, infants who may have, asthma, heart disease, other immunocompromising conditions, muscular dystrophy. And during pregnancy, 1 dose of maternal RSV vaccine, and that is Abrysvo, and that's the one that's recommended during pregnancy. If the parent gets it between 32 and 36 weeks of age, that is the recommended time to get it, so that it offers protection to the infant. So administered immediately before or during RSV season. So people who are pregnant now who are 32 to 36 weeks and their babies will be born during RSV season should definitely be counseled to get this vaccine. And then, let's see. Flu vaccine for everyone 6 months and older. And just a reminder that 2 doses are required for kids 8 and under who've never received flu vaccine, and that there is high dose flu vaccine, which is a little bit more of the antigen and produces, it sort of peaks the immune system of individuals over 65 who are starting to sort of have trending decreases in their immune response. So it just gives them a little bit extra nudge to generate those antibodies. And I do want to say that there have been some concerns about the supply of nirsevimab. It has been much more demand than supply that's available. And so there may be updated recommendations to providers for when to use this vaccine. And I should say that we call it a vaccine because it's something that we want parents to understand is something that's recommended for their infants, but it really is an antibody. That gets confusing when you have to describe it. Essentially, you give it to a child to prevent infection, and so it functions as a vaccine. So I did just want to make that point of clarification. But there may be updated recommendations for pediatric doses of this vaccine, and it probably the CDC will create some communication for providers, suggesting that that priority be given to those infants 6 months of age and younger, until there is an increased supply. So just look for that. Not sure when that will be available to the public, but Dr. Cohen did talk to us during a recent meeting and said that this is coming. And again, don't forget about that maternal vaccine. Next slide, please. I think that's all I have.
Wonderful. Joan, thank you so much.
You're welcome.
Especially that RSV information, so helpful. I just can't figure out why they pick those names that are so hard to say and remember. But we do have a couple questions. Mariana, do you want to ask your question?
Sure, and thank you, Dr. Duby, for a great update. Yeah, so I was just wondering if there is a Kansas-specific resource to find sites that offer COVID treatment for uninsured individuals.
Yeah, so COVID treatment. I believe on our Know Before You Go KS.com map, those treatment sites are indicated, the ones that coincide with our community testing partners, but also their ASPR has a map. And I'm going to put a link to that, Mariana, in the chat box so that everybody can play around with it a little bit. And I think you just put in your state and then maybe your zip code or something, and locations that have those treatments available should pop up on the map for you. Thanks for that question.
Thank
We
you.
also had a question from Christina Pacheco.
Hey, Christina.
Hi, thank you, Dr. Duvey. I also had just a few questions. So for our folks who never have received a COVID-19 vaccine, but maybe have decided that they want to now, is getting the current vaccine all they need to do, or will there need to be additional vaccinations required?
Yeah, so the current vaccine is the only vaccine that is available now. And the map will help you figure out sort of what is needed. And I am just, I don't know if you can go back to that map for me, Jimena.